Welcome, everyone. My name is Ash Cross. I use they, them, and she, her pronouns. Now, I am a former therapist turned career coach. I'm so excited to share with you a little bit more about careers outside of clinical care and translating your therapy skills into new career paths. Within the past week, our group has grown by almost 400 members. So I know that this is a highly sought after subject from physical therapists, occupational therapists, psychotherapists, and speech pathologists. So I know that this is incredibly relevant. Before we hop in and get started, again, feel free to pop your questions in the chat throughout this presentation. Just for the sake of time, I'm going to go ahead and set a timer. When it goes off, don't be startled. That just means we need to wrap up and go into the Q&A portion. Awesome. So quick bit about me and my background. I have a master's degree in clinical mental health counseling and spent 5 years pre-license trying to get enough hours for my license and really burn myself out. I was working 2 to 3 contract jobs at any point while balancing a full-time career in higher ed. So it was quite a lot. So in grad school, I worked in career services, absolutely loved it, and have been doing freelance career coaching in higher ed ever since. So I absolutely love it. I love how my clients can see the difference within one session, which is huge compared to trauma counseling, which I also used to do. And I've worked with a variety of fields, so I'm really excited to geek out over this topic. But because I didn't get my license, I want to help therapists really identify what are the other career paths. So there's coaching, but there's so many different realms in coaching. There's so many different industries in general. So if you're in my Facebook group and you gave me your email address, you probably have received my free industry guide. We might be referencing that throughout. If not, no big deal. I'll be sending one out with the recording after today. I've worked with healthcare, finance, tech consulting, also worked with nonprofits and even niches like data analytics, quantitative finance, or programming on Wall Street, and interior design. So it really can cover a lot of different topics. All right. And then I've been where you are too. So like I said, I've dealt with high caseloads. I've dealt with building a caseload in a rural area, dealt with low pay, heavy paperwork, managers really not knowing what we do and how significant it is, and the long hours plus the commute. A lot of this we don't get paid for, and then we get all these other duties set on us. So I totally understand burning out and wanting to consider other career options or consider something on the side that is not necessarily patient facing. All right, so here's our agenda for today. We're going to go over the transferable skills. We're going to go over what other careers are out there, where to start, like how to go ahead and get moving on this, and then the Q&A. So like I said, I've got a timer going so we can go ahead and hop into the Q&A portion on time. I want to answer as many questions as possible. And feel free to pop questions in throughout the time at the chat. We'll just answer them at that. Awesome. So let's get started. Transferable skills as therapists, we don't realize how many skills we have that are clinical that relate to other fields. Our ability to build relationships with a diverse group of people, that's incredibly important. Our ability to adapt techniques and our methodologies based on the client's individual needs. So somebody coming in for one topic might not benefit from the same type of therapy as somebody else. And then also our ability to set expectations and refocus clients. You can imagine when going into a meeting that comes in real handy because people can go on tangents, they can go off the agenda, and you can bring them back because you only have a finite amount of time. So that's a leadership skill a lot of therapists don't realize they have. We also have the skills of facilitating change, so creating that environment for change. For me, I love Francesca and Di Clemente's readiness to change wheel. So in motivational interviewing, it's really about moving them from the pre-contemplative stage to the contemplative to the taking action. So I always use that framework even in coaching. That comes in handy as we lead groups and as we really create an environment that clients want to grow in. We also track milestones and goals. So that's not always the fun part of our job. That's often where Medicaid compliance, Medicare, insurance, all that nonsense comes in, and it actually drains us from our jobs. But it's highly relevant in any skill in corporate or nonprofit or public sector. So we also have the ability, and this is one of my favorites, to simplify complex concepts and recognize patterns. So those active listening skills, kind of reframing them as this, can be so useful. And recognizing patterns in all sorts of environments. So I'm going to pause here. I know it's a ton of information, but the last time I did a webinar like this was absolutely everyone's favorite slide. So feel free to take a screenshot. Like I said, I'll be sending the recording out too, so you can pause throughout. And I'll send out the slides as well. But really, when it comes to this, and I'm going to move my Zoom so I can see the whole screen. There we go. When it comes to this, I wanted to share kind of the language swap and the mentality swap from working in a clinical environment to working in other types of roles and industries. So our audience, we're often using the phrases clients, patients, treatment terms. Those become stakeholders, customers, users, depending on what kind of role we go into. So the point of this is really to help you start adapting your language on your LinkedIn, on your resume, as you share your story in your cover letter or interviews, or even just networking. Kind of keeping in mind that this clinical focus does not always translate, but here are some ways other people can hear it in a way that's impactful and they do understand. So for me, as a mental health therapist, I used to say biopsychosocial all the time, or your classic intake. In the corporate world, that's onboarding paperwork, that's setting those expectations. That's also needs assessment, which is crucial across any roles. So it's really, what are you coming in for? What's our game plan to reach your goals? What are the specific techniques I'm going to use? And what are those outcomes? Those are transferable whether you're in marketing, whether you're in research, whether you're in education or finance. You're really trying to make sure that you understand what somebody's coming in with. So, like I said, this is a lot. So I'm not necessarily going over word for word, but plan and strategy, we might talk about treatment plan, that might be a roadmap or timeline, or really looking at the vision of where we're going. Another big thing we always think of as therapists is evidence-based techniques or evidence-based treatment. That translates in the corporate world to data-driven strategies. I've seen that on so many job descriptions in the past couple of years, especially. And then action items. Those are what our homework assignments are, what our techniques are, what the client's walking away with. And then also the outcomes piece that actually translates into key performance indicators, milestones, success metrics. Those are phrases that are commonly recognized. And then another piece I think that we all struggle with is, how do we talk about the depth and scope of what we're doing when it comes to the documentation? It's so much of our job, and why so many of us are burned out, and why we're considering other types of careers. But that documentation is crucial. Rather than talking about charting your progress notes, you're instead providing status updates to stakeholders, or you're offering deliverables in a timely fashion. Maybe even streamlining the process as well. And then educating the client. We do so much of this. So psychoeducation, we might call instruction, teaching, anything like that. So that's directly relevant to instructional roles when it comes to corporate training, when it comes to teaching, when it comes to learning and development, which we talked about in the group a couple weeks ago. So, all right. Went over so many transferable skills in a hot minute. So I want to pause here and see if anybody has any questions on that type of content. You can raise your hand or you can pop in the chat. Nope. All right, we'll go ahead and move on then. So what other careers are out there? I There are so many career options, we can get overwhelmed. And I will say I'm neurodivergent, and one of my strengths, Gallup strengths, which we use in academia, is called input. So I like to take in so much information, and I like to give it that information as well and make it as concrete as possible so you can visualize yourself in these types of roles. That said, it's a lot of information. So I'm going to take a lot of pauses. Again, the recording is going to go out, the slides will go out, so you have a better idea to reference in the future. And that industry guide, along with something I will tell you guys about later that I've launched, these resources are really going to help you break it down step by step, so it's not information overload. This is going to go over, I kind of categorized it by people focused, people in systems. So if you want some level of interaction, maybe not client facing, but different kinds of interaction, and you want to play with the systems or the data. System focused, so really focusing on structure, data, numbers, that type of thing. Communication and design, these are always the fun ones in my opinion, where it might be minimal client interaction face to face, but it's a lot of content development and creation. And then healthcare non-patient facing. I wanted to make sure, even though this is focused on translating your clinical skills to other fields, so many of you had mentioned you want to do something healthcare related, just not patient facing. So I wanted to address those as well. All right. Let's start with people focus. So if you really have those social skills, those interpersonal skills, and you hate the paperwork that comes involved, yes, these other roles might involve paperwork to different degrees and very similar to what you have done before, just a new format. You really want to make sure you're making an impact with those individuals and groups, and you love connecting them with other people or resources. So here are some different kinds of roles that might fall into. A lot of you mentioned you're interested in coaching and consulting. So I wanted to share a few different types of coaches that are out there. Recently, I've spoken with health and wellness coaches. I'm a career coach. There's relationship coaches, and there's also peer support specialists. So even though I'm not a therapist, I actually run a peer support group for cancer care. So I volunteer my time, but I'm not taking on a therapist role. So there's that type of thing as well. There's so many different types of coaching. What I'm going to encourage you to do is, I'm a big fan of generative AI. So I would recommend using ChatGPT to ask some of these follow-up questions, like what are the different realms of coaching? Or how does counseling and coaching overlap? So ChatGPT is my favorite AI so far. I've heard good things about Claude as well, especially from the research and psychology focus. So I might recommend that as kind of like a follow-up next step to this webinar. And then we have nonprofit and social services. A lot of you love making that impact and still want to work one-on-one. So those other ways of doing that is coordinating different programs, or running those programs as a facilitator, doing community outreach, working on a crisis line. So that might be, unfortunately, the Trevor Project and a couple other crisis lines are down now in the US due to some recent changes. However, there are other crisis lines out there and resource lines out there that are available. So that would be helping people by phone or helping people by text. And then also there's other realms too. So foster care support, guardian ad litem, all these things when it comes to nonprofit. If you do want to get started, volunteering or attending nonprofit events might be a really good way to get your foot in the door and start talking to people to learn what it looks like before you dive into that as your next career. Also, education and training. I'm not just talking about K through 12. That's often what people think when it comes to education. But I'm talking about learning and development, corporate training as well, along with higher ed, being an adjunct professor or an instructor. or e-learning course instructor. So currently I'm working on creating an e-course teaching my style of career coaching and career counseling. And executive development, a lot of people don't realize that this is a field at all. So leadership or executive development, one of my grad school actually had a partnership with a nonprofit leadership development organization. So these organizations exist often with startup incubators in big cities or teamed up in academia with the universities and colleges. So executive education, continuing education coordinator, anything like that could be of interest as well. And then I had to do a plug for student affairs and higher ed because so many of my colleagues have a degree in counseling or a background in therapy, and they love their career in higher ed. I have to warn you, right now, as of July 2025, there are significant cuts in higher ed. So now might not be the time to go into that kind of career, but it could be a good time to network with those who are leaving or those who are staying to learn more about these different roles in academic advising, disability services, career services, the counseling center, even being like an intake coordinator or a program manager. Something like that can be really useful. All right, so let's move from people focus to people and systems focus. So this is a combination of, and if you see my mouse, I apologize, I'm admitting additional people into the webinar. But this is a combination of working with people on a stakeholder level, so maybe internally with teams or maybe clients, but of a different kind, like organizations instead of one-on-one clients. And then really focusing on the systems and process improvement and workflows. So you're preferring to work behind the scenes, but you are still interacting in teams as well. So HR and consulting comes to mind immediately. So thinking about employee mediation and employee experience programs, those employee resource groups or ERGs based on different affinities or identities, those became popular within the past few years. Recruiting or talent acquisition, that involves actually a lot of systems work. It's not just interviewing constantly. So it's going to use that analytical side of the brain and that information gathering and that strategy. And when it comes to recruiting as well, not only are you trying to find the right fit, but you have a timeline. So if you enjoy something faster paced, that would be potentially a good fit. Change management or organizational development. Some of you I've talked to have thought about going for a master's or PhD in industrial organizational psych. So that's really what change management and organizational development is. It's taking a look at how the teams work and how the teams have functioned so far and transitioning it to how the teams can be more effective in their functioning, or maybe they're moving from one system to another. I'm sure you all have experienced that when it comes to insurance or the EHR changing over, and then you have to learn a new system and it gets really annoying. But if you're good at that, organizational development, change management, uh, anything along those lines, or project management as well, that can be really useful as you translate that into different industries. Because it takes a special kind of person to be able to deal with all the backlash and explain these complex concepts in a simple, easy to follow way. So tech also, a lot of you have mentioned going into tech. I will caution you again, as July 2025, there are a lot of tech layoffs. Yesterday, we saw Microsoft lay off 9,000 people. So if you are looking in tech, now might be a good time to consider looking in startups or consider contract work. So user experience researcher, that's really gathering data or even testing platforms yourself to figure out how to make the user experience more streamlined, more friendly. So again, thinking about those EHRs and how many complicated steps there are to get where you want to go. How can we improve that dashboard experience or that navigation? That's really what user experience looks at. Onboarding as well. So again, kind of this one, instead of patient onboarding or employee onboarding, it's working with customers or clients. Or it could be working with training the people who are entering the organization in different capacities. So onboarding for me is one of my favorite topics. And same with customer success, which is basically the in-between person between the customer who's requesting features and the product technical developers who are creating those features. So the customer success person translates what the customer needs to the tech individual so they can create it. System administrator. So if you really love being behind the scenes in tech, system administrator, like a learning management system, an electronic health record system, or this might be a new one for some of you unfamiliar with tech, but SaaS or software as a service, you'll see that on a lot of roles in tech. Basically, your EHR, that is a SaaS platform. So if you see something like a system administrator and you really love streamlining those workflows and making it easier, but doing it yourself rather than showing everybody, that could be a potential good role. An implementation specialist, that's really walking you through step by step what else you can expect when a project rolls out. And I'd be amiss if I didn't talk about project management. So much of what you do when you manage programs, when you manage one-on-one and group, or you're launching a new group and you have to do the marketing, maybe if you're in private practice, so much of what you do is project management. And if you're in a clinical setting, you know this because you have all these tasks outside of therapy that you have to manage. So thinking about that from that project management perspective. And here I'm going to do a little plug as well. I have a transferable skills assessment in my career change starter kit that really dives deep into these different skill sets to help you identify with the help of AI what types of roles could interest you. So I know I spent a really, really long time on this, and I've got a couple categories. So definitely recommend if you are interested in any of these in particular, let's talk one-on-one during a strategy session so we can dive more into these different roles and what your skills are. All right, so let's talk about system and data focused roles. So say you're over people and you really just want to work on the back end with your data, with your screens, with your research, that type of thing. These roles could be a move for you. So these are kind of also more at the macro level, not necessarily one-on-one working with clients. So this is looking at public policy, risk management or compliance. So thinking about your skills in crisis management, that transfers over nicely into regulatory affairs or auditing as well. Legal services, paralegal is a good way to get trained without having to go for a totally new degree if you are trying to get in the legal field. And then finance as well, working with grants. That could be something you're interested in, coordinating those different grants and allocating those resources. And then insurance as well. Some of you had mentioned, I'm interested in billing and coding, or I'm interested in handling insurance claims. That would fall under here as well. All right. And then communication and design. These are kind of some of my favorites. When it comes to me, I am a process person, a people person, and a design thinker. So if you love crafting messages, telling stories, whether that's through writing, whether that's visually, whether that's through organization, some of these careers could be for you. Try that again. So marketing and messaging or doing PR, that could be useful. Or even managing the content itself. If you're creating the content or managing the content, that could be something good on the back end. Content creation takes a ton of different ways. So I've worked with an SLP who is actually generating pitchbooks based on her experience with like the letter R. And I'll do a shout out. You should definitely look into her book, which feel free to pop that book into the chat, Martha. And then also you can look into writing instructional manuals or something clinical basically walking somebody step by step into what you're doing. So even though these are communication and design-based careers, there can be that clinical spin to it that leverages your experience. And then also a whole bunch of other skills you're looking into. I've worked with some people who are going into graphic design as well. I worked with somebody who was an executive assistant for 20 years who wound up going back to school for interior design and absolutely loved it. So we worked on her portfolio building and talking about those skills. So visual spatial design, also a really great way to get involved in these ones, especially the bottom category, is through volunteering, local organizations, or freelancing. So that's a good way to start building your portfolio, building your reputation, and building that network to get your foot in the door. So a lot of these can be freelance type of careers. You just need to know how to market yourself, who to talk to, and where to post or look for these jobs. All right, switching back to healthcare itself. A lot of roles, I kind of divided this into two different categories. So operations and quality assurance, because that definitely comes naturally for all of you. Well, not all of you, but some of you, as you're going through clients' notes and needing to update them for certain insurance compliance, or maybe you're doing the updating as a supervisor for your supervisees. Looking into that can be useful too. I will say, sometimes, no matter how hard you try, a career is not the right fit. So again, I'm neurodivergent, which means I need a career that genuinely interests me. So I like to say that anything career is my special interest. But I tried my last role as a billing and coding specialist and absolutely hated it. The numbers would move on the Excel sheet. I'd be using 7 different databases, constantly forgetting how to navigate these things because I needed more support, more structure to my day as well. So sometimes the role's not a right fit. Sometimes the environment or supervising style is not the right fit. Sometimes it just doesn't interest you, no matter how hard you try, or it's counter to your nature. Another thing I did previously was I worked in a call center, and I had panic attacks daily and kind of gaslit myself through those panic attacks to hit that year mark. But boy, did my mental health suffer. And I thought something was wrong with me when really I was not in the right role that leveraged my skill set and leveraged what I use naturally. So that's also how I work with clients is I help them identify what is that career fit. And so also within healthcare, we have education and talent development. So the SLP who helps run our Facebook group, Alex, she is actually a clinical recruiter in addition to an SLP and has taken on administrative roles too. But that would fall under talent development or workforce development. So this might include training the patients, training the office staff, training other therapists as they come in, or do that recruiting and talent acquisition, or even conducting the onboarding, conducting the initial training before passing it off. And learning and development, that comes in as well because you have to do that continuing education credit. You have to do some of those certifications each year. So designing those types of things would be something for, say, an instructional designer, but with a healthcare background, that would really be useful. All right. Ooh, that's a mouthful. So where do you start? So what we went over today are all the options. There's too many options. So we'll hop into the Q&A in a second. But I encourage you, identify what you like and don't. That's one of my favorite phrases to do with clients, is really taking a feel. And if you don't know what you like, start with what you don't like. So what is it about your current job that you really hate? That just feels like pulling a tooth. So what is it about your current job or previous jobs that haven't worked? And by looking at that, you're starting to understand, okay, well, what's the reverse of that? what would it look like if I didn't have that, or if my job was easier? What would those types of tasks look like? And start small when it comes to researching roles. I know I probably covered close to 50 rules today, but start small, start on 1 to 3. I would even take it smaller than that, one at a time, and maybe consume like watch a YouTube short or read a blog, or again, chat GPT is one of my favorites for career research. Tell me about this. And actually, this QR code links to my career change starter kit. So that has the transferable skills, that also has, and the transferable skills are broken down by categories, kind of like what I showed you today. And it helps you think about, how much interaction do I want? What times a day do I work best? What types of settings do I really want to travel and deal with that commute to and from clients, or do I want to be in one place? So a lot of these things you don't get in traditional career assessments, I have in my starter kit. And then I have AI prompts you can plug into Chat GPT to really start taking a look at these roles one by one. What are the job titles relevant to this? What are the industries that hire this? Or tell me in one sentence what this person does in layman's language. So even though I'm not familiar, I can understand it. And then also, when it comes to this, after you've done this part, I encourage you, let's hop on a strategy call. Let's talk it out. So let's start coming up with a plan that's unique to you and your life and your potential burnout or situation. So we can start developing that short-term and long-term career planning. And then that also involves networking, rebranding, and upskilling. Those are the 3 areas. Yes, I can help with the job search, but I love working with career changers in particular, and therapists as well, because it's more big picture. It's more, how do I get my foot in the door? How do I start learning these technical skills so I can go ahead and apply for these jobs? And how can I survive my current job in the process, or survive my life and the other priorities? So that's where coaching comes in handy. All right. So I'm going to go ahead and open it up to questions now. Again, I know we covered a lot, so it might be a lot to process. If you come up with questions afterward, you're welcome to join the Facebook group and post them there. Reach out to me through Facebook or LinkedIn or email. Or just connect in general. I'll stick around for a few minutes after this webinar. But what kinds of questions do you have? And I can pull up that transferable skills table as well, just to kind of help you start thinking of some questions. Let me pull up that transferable skills table. Or if you need me to go to one of these slides so you can ask questions about that, a certain group, feel free, let me know. But in the chat, or you can unmute, what kind of questions do you all have? And I can stop the recording too, if that'll make it easier.